Hi, I'm Dr. Yusuf Mathai, founder of Oregon Health DPC, a concierge medical practice focused on giving patients the time that they need, access, and attention that they truly deserve. Now, if you're on Medicare or if you love someone who is, this video is for you. Because over the next 10 years, there's a massive shift happening in our healthcare system that's going to affect millions of people over the age of 65 and not in a good way. But there's also a smarter path forward, and so let's get into it. So here's the reality. The US is headed towards a serious physician shortage. The latest federal data shows we're expecting there to be about 86,000 doctors that we're going to be short of by the year 2036. And that number could be even higher when you account for retirements and increased demand from our aging population. Think about it. Every day more Americans turn 65. The number of seniors is exploding, but the number of physicians, that's not really keeping up. And guess who needs the most medical care? Those 65 and older. Regular checkups, chronic disease management, specialty visits, procedures. And yet with fewer physicians available, longer wait times, shorter visits, and more rushed care are becoming the norm, especially in the Medicare dependent system. Now, let's add another problem, which is declining Medicare reimbursements. Since the year 2001, when you adjust for inflation, Medicare has cut physician pay by more than 30%. And in 2025, it's happening again, another 2.8 percentage drop in reimbursements. That means your doctor is being asked to do more for sicker patients with less time and less pay. And the results? More doctors are closing their practices to Medicare patients. Others are quitting entirely. And small clinics, especially in rural or underserved areas, simply can't afford to stay open. So if you're a Medicare patient, you may have already noticed it's harder to get an appointment, you're waiting longer to be seen, you're rushed through your visits, and no one has time to coordinate your care. And it's not your fault, but unfortunately, it's a reality. So what are some of the consequences? So let me be very clear. This is a healthcare access crisis in the making, and we've already started to see the beginning of this. Seniors, the very people who built this country, raised their families, contributed to our communities, are getting squeezed out of a system they paid for, for decades. Many are being forced to rely on urgent care, bouncing between overworked providers, or delay care until it becomes an emergency. It's going to get a lot worse before it gets better unless something drastic changes. Now, that's why practices like ours are stepping up. We currently happen to be in what we call the concierge space. So at Oregon Health DPC, we truly believe that people over 65 deserve more than a 7-minute office visit and a prescription. What we offer is same-day or next-day visits, text and phone call access directly to your care team and doctor, longer unhurried appointments, coordinated care with your specialists, and a true physician, let me repeat this, a true physician advocate who knows your history, walks with you through every stage of your health journey. Now, we don't bill Medicare for your visits, which means we're not bound by the shrinking reimbursements or bloated red tape. Instead, our members pay a transparent monthly fee, and in return, they get the care that's proactive, personal, and built around them. So, if you're tired of feeling like a number, if you want a real relationship with the doctor again, and if you believe your time and health are worth protecting, then concierge care may be the smartest decision you can make for you or your loved one. If this resonates with you, I invite you to schedule a consultation with our team. Our number is 503-506-8500. Let's talk about what's going on with your health and whether we're the right fit to help you move forward with clarity and confidence. Again, I'm Dr. Yusuf Mathai at Oregon Health DPC, where we're defining what care looks like for seniors. Again, thank you so much for watching. Have a great day.